There it goes.
There we go.
Hi, I'm Tim Davis. I'm the school nurse here at Northport, and today I'm going to give a program on how to administer medications. Now previously the school was only allowed to administer oral medications. However, the state has changed that policy so that now we can administer oral, we can administer medication to the eyes, to the ear, and topical medication as well. So today we're going to go through the process of doing that. We have our guest star here today. What is your name?
Emily.
Emily is going to be our guinea pig to give medications to. And we have
Brian.
Brian is our video recorder today. So, Emily, today we are going to give you 3 medications. We're going to give you an oral medication. We're going to put a drop in your eye for an eye medication, and a drop in your ear for ear medication. Actually 4. We're going to put some topical medication on in case you had an order for the doctor to give you some topical medication. Now, to begin this process, we have to realize that no medication can be given, whether it's over the counter or whether it's prescribed by a physician, cannot be given unless there is a doctor's order and there is an order signed by the parents requesting this. Now, the doctor can request you request the school to give the medication, and if the medication is going to be given over 15 days, then the doctor has to give instructions as well. So that's a little point that you have to keep in mind. If it's a medication that's going to be given on a long-term basis, then the doctor himself has to provide the instructions for that. If it's a short-term basis, less than 15 days, he just has to give the prescription for the medication, and then the parent has to give their okay. Now, that form for them to do that is in the red book here, which is going to be in the sick room right next to the box. And this is a very important booklet because in here will be all the forms you'll need for this type of thing. Okay, so let's look at what we'll need. First of all, we have the order for the medication to be given to the student that has been signed by a licensed healthcare professional and also okayed by the parent. Now that form is right here in this booklet, and it's toward the back where I have some extra forms. So that form will have to be filled out before we even begin to give a medication to a student. Now, the second thing we're going to do is we're going to make sure we have the right student. Okay, I want to find that out by 2 sources. Not just one source, I have to have 2 sources to show that she's the right student. What is your name?
Emily.
Emily. How do I know that she's telling me the truth? Well, I could ask her teacher, I could ask her mother. Excuse me, ma'am, are you Emily's mother?
Yes.
Is this Emily?
Yes.
Oh, good. I have the right student. Now, that's step 1, to make sure you have the right student. Step number 2 is very important, and you follow me over here, Brian. We're going to go over to the water, and we're going to wash our hands. Washing, 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 soap, wash, and rinse. At least 20 seconds of washing. Okay, so we've done important thing is wash our hands. Okay, then we'll come back over to our student. And if we're going to administer oral medication, here's what we're going to do. We have to make sure that the bottle the medication is in is the original bottle. We don't want medication to be put in some secondary bottle that the parents send along to the student. If they want to keep some doses at home, they can ask the pharmacy to label 2 bottles for them, one for school and one for home. Or if they're confident, they can take the prescription bottle with the label on it, send it to school, and they can put their own medication in a bottle at home and label it themselves if they want to. Okay, there's several things that have to be on this. The doctor's name, the right date, it's not outdated, the student's name has to be on there, the name of the medication and the dose, and the expiration date. When all of those are on there, then we're safe to give that medication. Well, Emily, it looks like everything's fine here. We have the right student, we have the right medication, we have the right date, the right labeling. Now, we're going to see if it's the right time. So, what time is this medicine due? Looks like it's due at 10 o'clock. So that gives me a half hour each direction. I can start at 9:30 or I can start at 10:30, pretty much in the ballpark. I give you that little leeway there. So we have the right student, we have the right medication, we have the right dose, we have the right time, and now we're going to see if there's the right route. Well, obviously this is going to be oral medication because it's a pill. However, a liquid medication, that could be confusing. Otic, for example, is for the ear. Optic is for the eye. Make sure you don't goof that up. Now, let's demonstrate how we're going to give this medication to Emily. I'm going to open the bottle, and I am going to put one of the pills into the lid of the, looks like we have one on the ground there too. But I get one medication in the lid. Now what happens if you drop it on the ground? Good question. In the hospital, we couldn't give it to him. In real life, after all, the poor kid probably eats stuff off the ground all the time. If she drops her peanut butter sandwich, she picks it up if it isn't face down, right? But anyway, there you go. We pick out one pill. It's the right dose. I'm going to put it in the cup. The right route, the right time, the right student, the right medication, and the right date. And we're going to hand it to the student. She is going to take the medication from the cup and put it in her mouth and drink it down with a drink of water. We're not going to actually give this pill to Emily. She isn't sick right now. So that is an oral medication. Now how about a ear medication? The ear medication has to go through the same process as the oral medication: the right student, the right medication, the right dose, the right route, the right time, the right date. And we've got that all together now. So what am I going to do? I have the medication. The right dose is in here. I'm going to put 2 drops in Emily's ear. So what I'll do is, again, I've washed my hands. And now, if I'm going to put a medication in her ear, I'm going to put a set of gloves on. How about that? And the gloves are located in the sick room in there. So Emily, I'm going to put a pair of gloves on so that I can put these drops in your ear. So here we go. I'm going to pull up on Emily's ear, have her tilt her head to the side, and I'm going to drop 1, 2 drops in there. And then I usually run the tragus of the ear gently around towards the medication in. So you want to pull up in the ear, that opens the ear canal. Don't pull too much. Drop the drops in, and then I usually push on the tragus of the ear. New word for you, huh? Tragus. And that squishes the medicine all around in there. And then Emily is good to go. Sometimes she can stay in that position for a minute or two, and that'll be fine. How about optical, medicine that goes in the eye? Again, we're going to get the medication, make sure we have the right student, the right medication, the right dose, the right time, make sure that medication's in date, and we're going to, again, wash our hands, put on a pair of gloves, and this is the process you do for the eye. Emily, I'm going to have you tilt your eye back. That's a gal. And look up. That's real good. Now when I pull down on the eye, you have to blink, go ahead. When I pull down on the eye, you'll notice that that makes a little pocket right there. Make sure you have it in the correct eye. And you notice that little pocket. And I'm going to drop 1, 2 drops in the eye, right in that little pocket that forms when I pull down. And then Emily is going to blink and then mix the medicine around in the eye. And there we go. She can dab her eye off with a tissue and dab her cheek off to get the medicine from dripping down her face. Okay, the medicine that's left now is going to be the topical. Now Emily has a cut in her hand that had gotten a little infected, and the doctor says he wants this medicine put on that cut during school hours. Now I'm going to interject one little thought here, and that is, do you have to do it during school hours, doctor? If it has to be given 3 times a day, couldn't you give it before school, after school, and at bedtime? Do you really have to have it during school? We really would prefer you don't have it during school, if at all possible. If you insist, doctor, that she have it during that particular school time, then we will accommodate you, but please, try to work around it. All the teachers are busy, everyone's busy here at school, and doing this takes time. Okay. Again, we're going to make sure that it is the right student, the right medication, the right time, the right date, the right route, we're going to take a little of the topical medication. Again, we're going to wear gloves, and we're going to pretend that this is a nice little cut right there that according to the doctor's instructions we may have had to wash off previous to applying this medicine, or maybe not. It depends on there may be a dressing to put on there afterwards, and maybe not. We'll have to depend on the doctor's order. So we'll put some medicine onto the Q-tip, as you can see there, and then we'll apply the medicine to the wound or to the area that needs to be applied to, and make sure that that's all worked in nice. And then whether we follow up with a dressing or so forth will depend on the instructions that the physician gave us. Now, when we're finished with giving the medication that we've given, again in our book right here, we'll see that there is a form. And this form will be filled out for the student. And this form will record the medication. And this form will be put in a little folder there in the box in there, or you can be left in the book. And you will put your date and the time and your initials, the student name here, their birth date, the teacher, and so forth, the name of the medication, the dosage, the time of day. That will be logged in. And as you can see, there are many opportunities to log many doses of that medication. If it's going to be a daily dose of a medication, you may have to have more than one log in there for a school year, because they fill up fast. So, one more thing, and that is, what if accidentally you gave the wrong medication to a student? Either you made an error in one of the ways. You were late on giving the medication, you gave the medication to a wrong student. It happens. I'm telling you, it happens. You gave it the wrong route. Again, that happens. I promise you. Accidents happen. I remember a nurse telling me one time, well, if you check the 5 rights, how could you, actually there's 6 rights, how could you possibly make a mistake? I said, just wait, you'll see. He said, that's impossible for them to make a mistake giving medicine. You check the 5 rights, 6 rights, how could you possibly go wrong? It wasn't even a month after that. He had to fill out an incident report for a medication error, giving the wrong dose of insulin. So he was now among all the nurses who realized that errors do happen. And they will happen. If they do happen, you fill out this report. If it's a serious error, if you feel there's a problem, you definitely call the nurse or the doctor or the parent. You let the nurse know, you fill this out, and this incident report form will notify us that there has been a medication error. So, let us just review very quickly that if you have a student come in that requires medication to be given, that you have to first of all have a form filled out that tells you that the physician and the parent both agree with this medication to be given to the student. The form is here in this little red book. They have to be filled out. Secondly, you check the 5 rights. Now I've put down in this little booklet here a nice little list of the 5 rights, the 6 rights, to give to the, to make sure that you have all those things intact. The right student, the right medication, the right dose, the right route, the right time, and the right documentation. Actually, I'd like to put on there one more thing, and that is the right date. Medications can go out of date. So, you filled out the medication. You make sure that these 6 rights are there, actually 7 in my opinion. You make sure that you wash your hands, you give the medication the proper way, whether it be oral, whether it be optic, whether it be otic, whether it be topical. You document that you've given the medication, and that make sure that the medication's been swallowed or it's in the ear. And you document that and record if you have any errors in giving the medication. And this booklet is safely kept in there. And then the medication is kept in a storage locker, which is in the sick room, locked up buy it with a key so that it's nice and safe for the next dose. So if there's any questions, please let us know, and I want to thank you for Emily, and I want to thank you for Brian for helping with the video today. Good day.